Hi man, thank you for taking the time for joining us today for our Facebook Live session. If you could briefly start, if you could please help us with a brief introduction about yourself and your background in oncology.
Hi, good morning everyone. I'm Dr. Mathangi, a radiation oncologist, means a consultant treating the cancer patient with radiotherapy, and I'm having an experience of more than 20 years and started the Department of Oncology at BGS Gleneagles Global Hospital and working here for the past 13 years with an extensive team of medical oncologists and surgical oncologists and pediatric oncologists here.
We just wanted to start with, the most of the common questions we asked is how is cancer prevention important, and how can we start with steps on how we can understand the risks of cancer and how we can prevent.
Oh, that's a wonderful question to start the session. So, to be very clear, every patient walking in, every oncologist opinion, not only my patients, every patient has this question: why did I get cancer? So otherwise, general population is thinking like, how can I prevent myself? What all things can I do to prevent myself from getting a cancer? So is it really possible 100% to avoid or protect myself from getting a cancer? It's a very difficult question to answer, but at least we know certain habits and certain lifestyle changes are really connected to the risk of developing a cancer. So at least if you are giving attention to such things, we may be able to prevent the preventable cancers. That is what my exact point. Not all cancers are preventable, but definitely there are habits which are relating to cancer that can be completely preventable.
Wonderful, man. Man, also we just wanted to build on this. Could you help us with the different types of cancers which are most commonly present?
So, an oncologist will be without a job if people are not using tobacco. That's the simplest answer, whether it is men or women. If you see the highest or leading cause of cancer or the leading cancers are all tobacco related cancers. Whether it is lung cancer in men because it is of smoking habit, or women it is because of chewing tobacco. So the head and neck and oral cancers are very high. Of course, we know that every family or every house is now facing the situation of a very high incidence of breast cancers. And there is something called a very silent killing disease called a cervical cancer in women, which can be completely preventable and completely curable. Still, India is contributing to more than 1/4 of death in the entire world. So these are all the few cancers. Lung cancers is completely preventable. But there are still cancers in women in lung cancers. We do not know why they are getting. They are not smoking, they don't have, but there are certain genetic mutations which are resulting in lung cancers. So let us discuss about that in detail later.
Sure, man. Again, building on the discussion of lifestyle habits which develop to cancer, can you explain what are the few daily habits which or daily practices which might lead to the development of cancer?
So that's a wonderful question. So this is also related to our cancer prevention. So how do we do cancer prevention? By changing the lifestyle, or what are the lifestyles that is actually leading to cancer? Number one, why were we not having cancers before and why are we having cancers now? It starts right from the food what you eat, what you do in the day and what you do not do in the day, and then of course what are the extra habits that you have. So for example, diet and your physical activity and your weight. It is not like every obese person is going to develop cancer, but of course obesity is a very, very important risk factor. And then you have your walking and other physical activities. And somebody does not believe that something called a sunlight exposure. Sunlight exposure is very, very important. And of course your habits, what you're doing on your Saturday and Sunday, whether it is a little party with a biryani and a little smoking and a little alcohol, and of course lying down entire day only on a couch for the entire week other days. So what are we going to? That is what we are going to discuss in detail now, every independent risk factors.
Definitely. And so again, building on the points which we had discussed, how does, say, tobacco and alcohol affect, since that is one of the most common reasons, how does tobacco and alcohol, increase the risk factor in cancer?
That's a very, very common question, and we all know the answer, but still it is very difficult for me. See, for example, when I go for breast cancer awareness or cervical cancer awareness, nobody asks me questions. They just blindly say, yes, they will follow. I don't know whether they follow it, but at least they'll say they'll follow it. But the moment I say about tobacco awareness, there will be n number of questions, n number of denials, n number of non-acceptance saying that not necessarily. My father smoked, he is completely well. I am smoking, I am completely well. No. Smoking does not only cause cancer. Cancer is also a result of tobacco and smoking. But if you take cancer patients, most of them are related to tobacco and alcohol habits. And the most interesting factor is, if you are having tobacco in any form, whether it is smoking or smokeless, it can be also addition. Say, people say that I just do only BD, okay, or I only smoke. I don't understand what is that I only smoke, because there is another person who has a combination of factors. He says, yes, I also drink, that is second thing, and of course we have a big list in India, jarda, pan, gutka, madhu, and you keep it something under the tongue, over the tongue, inside the nose and inside the palate, and twisting the cigarette inside, and there are a lot of styles, okay. So these all things, remember, tobacco is not just affecting there by the smoke and the chemical agents. It gets into your circulation, enters the blood and reaches each and every organ. And that is why tobacco can cause 17 different types of cancer. What are the cancers? It can be from your oral cavity, oropharynx, nasopharynx, your voice cords, or your food pipe, or your windpipe, or your lungs, or your intestine, your uterus, your liver, your pancreas, your stomach, name the things. Of course, we have gone down to the anal canal. Everything is related, right? From your head to foot, these chemicals go, stays there, and today you say, today I'm going to stop tobacco. Yes, very good. Probably you will reach your general population risk after 10 years. So better to stop now. And even better is never to start it. And then what about this alcohol? Alcohol is straightly linked to your liver damage, pancreatic damage. Everybody we knows. But the combination effect, everybody thinks 1 plus 1 is 2 when tobacco and alcohol is considered. No, that is 1 plus 1 is equal to 100 there, because the alcohol helps all the chemicals in the cigarette to get completely dissolved and happily enter your circulation and be more toxic to you. So it is not even a synergistic effect, it is a multiplicative effect. So alcohol and cigarette, I just had a biryani, for a digestion I had a cigarette, and for fun I had alcohol. This is a deadly combo. Why I am seeing most of the patients at the age of 25 to 30 years now. And the rest of the time we sit with a radiating laptop and a couch potato status the entire weekdays. Yeah.
Building on our last conversation, we wanted to see how the factors like obesity contribute to cancer, and if there are any food or lifestyle, again food or eating habits, which could relate to cancer or any cancerous growth in the body.
Yeah, that's a big extensive topic for us to discuss. For example, a lady who was just in late 20s called me yesterday and asked, Madam, I have to reduce weight. You know what the nutritional management person has told? She has given 30,000 rupees worth of nutritional supplements to reduce the weight. What I just said is, go out in the sun and just do something called physical activity or walking. That itself will reduce your weight. The most important thing that we are forgetting in management of obesity is moving yourself. Right from heart problems, right from your sugar or your hypertension, of course, and depending on the cancer, everything depending on your moving time versus sitting time, number one. That is called the physical activity. Whatever you want to do, keep moving, keep walking, and don't just be sitting. That's what I always say is a couch potato. I don't even get up. See, for example, right from getting up, I am in my bed, and then dining table, sofa, four-wheeler or two-wheeler, coming to the office, again going back in the four-wheeler or two-wheeler, going back to your sofa and to the bed. There is a long time since somebody has bent and done some work. That is why we are different. Why are we getting it now? Why our ancestors did not have risk? Why, when I was studying, I have very rarely seen breast cancers, but now breast cancers are the leading cause. Every cc of your fat is getting converted into steroidal hormones, the so-called estrogen, progesterone, and it is continuously stimulating your breast as well as your uterus. And that is why one of the risks is longer your menstrual life. What is longer menstrual life? You're having early menarche. Nowadays, girls are going for 8 years menarche, and even 54 or 58, they are not still getting their menopause because every fat material is still releasing their tissue. If you see girl children are not allowed to go out and play. They're always at home, not allowed to sunlight exposure, and not having a very thin, not to be chubby. You have to be very, very thin, muscular, active and exposed to sunlight and playing as much as possible when the breast is developing. Not that I'm going to retire and then think about when I'm going to go for a walk. No, the basic constitution of your health starts from your younger age, number one. So obesity starts from childhood. Being chubby during your childhood and then your adolescence and then your adult life, and then you still don't think about physical activity, at least it is better to start now. What does US recommendation says for prevention, cancer prevention? At least 45 minutes of moderate exercise per day, 5 days in a week, and they don't have sunlight, they use vitamin D capsules. And why are we still doing vitamin D capsules when there is an open sunlight and we are not exposing ourselves to sunlight? So the physical activity every day and a good amount. What is walking? Again, physical activity. Everybody walks every day. Everybody tells me I walk for 1 hour. Walk. When you're walking, you will not be able to talk. That is the speed you have to walk. That is what they call it as moderate exercise. You want to run or swim or do. But yoga, somebody says yoga is like activity that doesn't expend calories. That is called power yoga or something like that is what is going to spend your calories, not by using stretching yoga or toning yoga. That is for stretching and relaxing after you have done a moderate exercises. So this is what is called obesity and physical activity. So be clear what you are doing and get exposed to a good amount of sunlight and be happy.
Wonderful, man. And also wanted to check, is there any tips we can give on a balanced nutrition or the impact of a diet?
Very good. So again, I left one point about talking about obesity, right? How do I know whether I'm an ideal weight? So that is how most of them ask. If your height is, for example, 156 centimeter, take away 100. That should be maximum weight of yours. And the shoulder width should be equivalent to your, for example, if you have to put an inch tape at your shoulder, it has to be equivalent at your hip level, and the in between at the umbilicus level, it should be at least lesser than all these two measurements. And for gents, obviously shoulder measurement should be more and the hip measurement should be obviously very less. So in turn, they call it as dumbbell shape for women. It is not for fashion, it is the healthy statement, and inverted V shape or the inverted triangle shape for every man. This is the health criteria. So now how do we balance with the nutrition? People immediately think about zero figure, I should not eat. So immediately I only eat solids, I only eat carrot and cucumber. It is not like that. This is called my plate. My plate is, if you have 1/3 of carbohydrates, 1/3 of protein, 1/3 of vegetables, and then you can have fruits and curd also. So the most important thing is simplify. How much ever vegetable or dal you are eating, that much of rice only you should eat. It is not like I eat rice with sambar, rice with rasam, rice with saru, rice with masru, and then little palya also. So that is what our ancestors have told. Our ancestral or our genetic makeup is for our food. What is our food? Every time we always follow US my plate consideration. But in southern or whatever Indian origin is, thali or bale ele uta, whatever we say, that side is vegetables and this side is rice. Why it is done that way? Rice should be equivalent to the vegetables consumed, and that is why different types of vegetables were served and not fried and deep fried vegetables. It should be very fresh vegetables, fresh fruits, and these should be more in your diet and not going empty stomach or not eating anything. It should be a balanced diet. The diet and your activity should be matching input and your expenditure. If this is matching, obviously you are enjoying a very, very healthy lifestyle. Most important small story, I would say that in US they conducted a study that Indians living there are not getting intestinal cancer. Americans living and eating the same thing are getting intestinal cancers. The interesting finding is your dhania and menthia in your sambar is the highest fiber that is protecting you from your intestinal risk. Of course, our genetic makeup is always there, but interesting findings are saying Indian culture, our own food, gives you the best protection. The most important message here is if you take food from other culture, be ready for the diseases from other culture. You have taken food from US, you want to eat pizza, burger and all those things, be ready for breast cancers. If you want to take only Chinese like fried rice, Ajinomoto, barbecued items, China is known for highest risk of cancer, incidence of cancer. So be ready when you are changing your food habits.
Yes, ma'am. And also just wanted to touch on the topic when it comes to sun safety. So we're having a lot of instances we're knowing about skin cancer related to sun related events.
Yes.
So probably what are the steps we could take?
So that's an interesting topic. Everybody says this, and of course everybody is traveling like a terrorist. Okay, they will be wearing a cooler, they'll be wearing an arm sleeves, and I will not even recognize this person standing in front of me. That is how we travel right now. If you're going in a two-wheeler or anywhere, we are trying to protect ourselves from tanning or sun or anything like that. But I would suggest a moderate exposure of sun is a must. So sun exposure is equivalent to your vitamin D capsules, plus vitamin D is not the only thing sun gives you. Sun exposure, sunlight exposure cures your depression, increases your immunity, and of course it reduces your cancer risk, not just the vitamin D capsules. But too much of sunlight exposure, we are filled with melanocytes. So for us getting a melanoma, or we have a very, very low risk for skin cancers compared to the Western population. Don't read Western journals and they say that I am not going to go into sun. They go intentionally and get, because they don't have melanocytes, they don't have protections, so they go and intentionally expose themselves and get tanned to make their pale skin look beautiful. But we are already beautiful with a lot of melanocytes, we are protected, but doesn't mean that you should never get into sunlight. Get a moderate amount of sunlight exposure. Most of the people walk between 5 to 6 o'clock where there is no sunlight, and that is why in spite of walking, in spite of going out, their vitamin D levels are not adequate. Vitamin D levels are not in the blood, it is here. You have to just go out, enjoy the fresh air and go out for walking and have a physical activity at the same time. Yeah.
Wonderful, ma'am. And while talking about, we also wanted to touch on topics on genetics and how that plays a role.
Very, very important question for the day. So the thing is, everybody thinks like my mother got a breast cancer, immediately I'll get a cancer. Any person, see, most of them are worried. So what are the actual cancer risk factors as a genetic? How do we really think? If a patient comes to my OPD, for example, in a breast cancer patient, if they are coming at an younger age, then I'm alert. Why should they get it at 30 years? There is something called a bad biology tumor, called a triple negative cancers in breast. So why should they get, for example, an 80-year-old should have a good biology disease, not a bad biology. Then I'm alarmed. So okay, bad biology, younger age, and then in a family, for example, I had it, my mother had it, my grandmother had it. Whatever cancer it may be uterine, ovary, or breast cancers, there is a risk of cancer exposure. But doesn't mean that my father was smoking, he got lung cancer, my grandfather was also smoking, and my grandmother had tobacco, chewing tobacco. All these people had, still you can go for, but not necessarily. It is like cumulative risk factors, familial risk factors, like he was also smoking, that is a different environmental factors. But environmental factors are completely different. Familial factors, like all of us didn't have any habits, but all of us had a cancer incidence. So then I go only for a genetic counseling, and then in the genetic counseling they will do a family tree, and then they see if in a first circle, blood related, my uncle's wife is not my blood relation, okay, so blood related, my blood relatives, 3 at least close first circle relatives. What are the first circle? Whom I am born from, okay, my parents, whom I am born with, who are born from me. Okay, these are the first circle. In this first circle, if you have 3 members at least, any types of cancer, just go for genetic counseling, number 1. Number 2, they will do the genetic counseling, and then probably take a small blood test, 5 ml blood test, and they will do a run around that and then check for the, but this has to be done for the patients who have had cancer, not that I do it and check it. So if the patients who had cancer go for this testing and it is found, then that mutation can be followed. Again, this mutation, even if it is positive, you only have 50 or 50% chance, not necessarily 100% chances. So if they have a mutation, we just get tested. If I'm not there, it is not there. You just belong to general population, still go for cancer screening like a general population. Otherwise, you're going to go like a high risk population. That's it. So prostate cancer, breast cancer, uterine cancers, ovarian cancers, all these things we generally ask them, and colorectal cancers, and cancers occurring at a younger age. So we generally tell them to go for genetic counseling, because you have to understand the risk of doing a genetic testing. Yes, thank you.
Sure, man. Man, again, just continuing this topic, what are the probably early detection or screening habits which people can take or adopt as a lifestyle that it probably can help them tackle cancer at an early stage?
So that's a very important question of the day, and the take-home message also. There are few cancers, still blessed by God we are, that we have some screening tests to catch it early, and then so you can have a good detection and a early detection and a good treatment and a good cure rates. Okay. So what are the cancers? For example, cervical cancer I have told about you, that happens in younger women or older women. It happens because of early start of the reproductive sexual life. Okay. So that is because during that time the HPV virus gets exposed. So the HPV virus starts some changes in the cervix, and then it may take 15 years for you to develop a cancer. In between, I just do some simple test by putting a brush there, collect the cells and check whether it is going to become malignant. That is called a pap smear or a liquid biopsy test. That's all. If I see any changes and treat you, probably you will never develop cancers. So a simple test called a pap smear. It starts at the age of 30, and once in 3 years you can just repeat it if it is negative. Or if you do HPV DNA directly, you can repeat it once in 5 years. So this is the one cancer where it is completely preventable, completely curable, and if you treat at the right time, treat in the right way, next 20-30 years you are not even going to think about this cancer. But still, people are dying. Okay, number one. Number two, breast cancers. Breast cancer, you start self-breast examination, whoever it is. Whether you have risk factors or no risk factors, start your self-breast examination. Know how your breasts are, that is from the age of 20 years when your breast is fully developed. After 40 years, depending upon your risk factors, you can either choose to get your mammography once in 2 years or yearly. So that is one thing. So the risk factor people, for example, my mother or somebody had a breast cancer in the family who are related to me, I start 5 years before doing the screening test. But if I'm younger, I'm not fit for mammography, is it ultrasound enough? No. If I have a high risk factor, better to go, if I find something wrong, better to go for an MRI before the treatment. That is also a screening for high risk patients. Colorectal cancer, intestine, very simple test. Collect your stool once a year, check whether there is something abnormal. Otherwise, once in a 5 year, just put a tube inside, look into your intestine. If there is abnormal, just leave it there. Just once in 5 years. Prostate cancer, just do your PSA every year, but after good counseling. Not necessarily PSA of 2 to 3 should alarm you, 3 to 4 that you have restless nights. It's not necessarily like that. Only your doctor will know whether it is really significant or not. So don't do self-testing and get worried. And then the most important thing for all dear smokers, and your mouth opening, in Kerala we had a testing, just by doing and looking yourself into the mirror. This is a simple screening test. You can see yourself if there is any white patch, red patch, black patches. Go and show to the doctor. This is leukoplakia, erythroplakia or melanoplakia, and has 30 to 50% of cancer development. Get these patches removed and quit smoking. That is simpler. And then of course, for lung, there is a very, very low dose CT scan can be done, but it has its own plus or minus. Only your doctor can decide about this, when to do, how to do it. So go to a doctor if you have any doubt about it. And habits, signs, early signs and symptoms, simple. Caution. Caution is any change in your bowel or bladder habits. See, for example, you're having a hoarseness of voice and suddenly you are changing, your voice is changing there. U is like urinary symptoms, suddenly you're having a blood in your urine or anything like that. And then T, any thickness or any lump in the breast or anywhere, suddenly a new lump is coming, or there was a lump for so many years that is suddenly increasing in size or changing in color or anything. And then you have your nagging cough, consistent cough. It is not going away at all, or sudden change in these voices. Like that, any complaints which is there for quite some time, or it is increasing in size, just get tested. I'm not saying it is cancer, but it is definitely a need, or the body is calling you and telling you, please get me tested. That's all. Thank you.
Thank you so much, Madam. Madam, so just wanted to close with last two things. Since nowadays there's a lot of information about cancers online, So how should people be little aware on what they should search online, what to believe on what they find online?
So thank you, Arshad. That was a wonderful question. Okay. See, for example, now I've got an opportunity to talk about cancer in just probably half an hour or 45 minutes. What should I do? I will just clump all the information, put it there into that. Not necessarily it is individualized or tailored to you. So that is why Google is not the only answer, or online is just to create awareness, not to create fear in you. Please kindly understand. So when I'm saying if you're a smoker, you will develop a lung cancer, I'm trying to say quit smoking, not that you're going to develop lung cancer. So the message between, don't read between the lines or don't take according to yours, because even when doctors, we used to study everything that is in the book, we felt we were having it. So it is usual for human to always think about negative things. So whatever it is there, please cross-check with your doctor. Not everything in Google should be inside you, and not everything inside will be known to the Google. So only a doctor who sees you, examines you and gets the appropriate test will know what is happening to you, and a tailored treatment has to be done. Yes.
Wonderful. Thank you so much, man. Man, so just wanted to close with this last question. Want to know what motivated you to specialize in radiation oncology?
That's a good question. In fact, radiation oncology is talking about cancer prevention. Always people ask me, why are you doing jobless things? Okay, it's not my job. Everybody thinks so. But what happens, unfortunately, in radiation oncology is the place where we have all end-of-life cancers with severe pain, severe bleeding, severe end-of-life issues that I'm not able to swallow, I'm not able to eat, I'm not able to pee, blood is pouring out, blood is coughing out. I just give a palliative radiation to keep them comfortable. And I've seen women coming with huge cauliflower-like growth with maggots inside. It made me think these people come to palliative radiation to at least, because surgeon cannot handle such things. So what should I do? Can't I just create awareness so that such patients don't come to me? All the cervical cancer patients come to me and get deserted in the OPD. For example, I told one single pap smear would have prevented even developing a cancer, but I see cancers which erode the bladder and the urine keeps pouring out and invading the nerves. Patient is dying out of pain, neither dying out of disease, but still every day suffering because of pain. All these patients, one day at 30 years, if they have done a pap smear, probably would not have developed a cancer at all. So I am doing my job best, but still it doesn't make me happy treating a palliative or end-of-life patients, seeing them in that state. Something could have been done earlier. That is why this cancer prevention has become my passion of life. Thank you.
Thank you so much, man. Ma'am, so we'll just close our session with maybe a few questions for our viewers. We'd love to hear your expert opinion when we're closing on these.
Yeah, sure. So this video will be tagged to my Facebook ID also. So please post your questions. I will reply independently also, or everything with the detailed answers according to your questions. Thank you.